Hello, my name is Alyssa Pierce. I just graduated from Sharon Springs High School, and I did my internship at the Cheyenne County Hospital and Clinic up in St. Francis. Just a little bit about where I was and kind of my schedule. My internship took place in St. Francis, like I said, at the hospital and clinic, as well as the health department there. It's actually a little over an hour from where I actually live. So with driving, they were able to work out a schedule with me where I could do 3 12-hour shifts, so I was only driving 3 times a week versus a traditional 9 to 5. With driving a round trip 2-hour, I actually learned that I really enjoyed driving to go there. It really helped me start my day gradually and kind of wind down after work. So that was something I kind of learned. My internship and how it relates to my future. This fall I'll be attending Fort Hays State University, majoring in nursing, planning to earn my RN Bachelor of Science in Nursing. While doing my internship with the Cheyenne County Hospital and Clinic, I was able to shadow the registered nurses there and their nursing interactions and medical procedures that they helped out with. Some practices and procedures that I got to observe while I was there. I am a certified nurse's aide as well as a certified medication aide, so I had those credentials going in, so I was a little bit more to help out with some things. So I did help out with and observe some standard CNA patient care for the activities of the daily living for the patients there, getting up, ambulating, going to the bathroom, stuff like that. Vital sign measurements I was able to observe as well as perform since that's in my scope of practice. Blood pressure, pulse, oxygen, stuff like that. Immunizations, that's something that I would see a lot more at the clinic and health department, people coming in, getting ready for the school year, stuff like that. Wound care is something that they have up there that they're really proud of up there in the hospital, so I got to watch a lot of that, which I did not think I would enjoy at all. I was kind of thankful to have the mask because they definitely can smell, but I thought it was really interesting to see the wounds and how they heal over time. IVs and labs such as urine, blood labs, stuff like that. Colonoscopies and endoscopies, which was very interesting, but I actually didn't mind. It was really cool to be able to see inside the body. Cesarean sections, C-sections. I actually did get to watch a C-section, which when I was applying for this internship, I did not think I would be able to see anything like that. So I think that was a very good experience. After it was done, I kind of did just want to go with the baby though. And then postpartum care. So I got to help out with a newborn hearing test, the newborn Billy test, which just tests for jaundice or bilirubin in the blood. Fundus checks, where they check the uterus, which a lot of the moms said was not their favorite part at all after labor. And then they would help the moms with the breastfeeding and then circumcision as well. Some hands-on stuff that I got to do while at the Cheyenne County Hospital. Not only did I observe, but I was able to help out with some other practices. I was able to strip the hospital rooms after a patient would leave. They're very particular about that. Everything has to be clean, especially with COVID and everything, very sterile, as well as make up the hospital beds when they were ready for a new admission to the hospital. I was able to take vital signs for ER patients, acute patients, new admissions, stuff like that. I was able to gather patient history and take their vital signs for pre-operations. They do some gallbladder operations there, hernias, the colonoscopies. So I really enjoyed that, just asking them about their allergies, stuff like that, getting to communicate with the patients. And then, of course, after the post-operation, you have to monitor them and stuff like that. So those were some hands-on things I was able to do as a CNA. Oh, and then I almost forgot. A helpful tip a nurse shared with me when placing an ECG, which they'll put on you before you go into an operation just to monitor your heart during it. When placing it, the correct placement, you can remember white on right and then smoke the black over fire the red, and that's where they would place that. Takeaways throughout my internship at the Cheyenne County Hospital and clinic, I learned and experienced many valuable things. I first learned the difference between healthcare facilities and the pace. So I worked at a nursing home in my hometown, Sharon Springs, for 2 years before I did this internship. And then going to do the internship at the hospital, I learned it's a much different pace because you're not always going to have those, going to the nursing home, there's going to be the same residents there every day. Whereas a hospital, there were days where there'd be no patients guaranteed, and other days there would be like a bunch of acute, a bunch of swing beds, and then 5 ERs come in at once, which was very interesting. So I definitely got to learn about how each healthcare facility is going to have a different pace to it. And then I also learned going forward as a nurse, it's going to take a lot of teamwork and flexibility, just because, at the beginning of the shift, they get their assignments, like you're going to have this many patients today. Well, then when 5 more ERs come in, you got to work with each other. Who's going to take this? Who's going to take this? So I learned, going forward, you got to be flexible and be able to have a really good teamwork. And then I was also able to experience a very different side of healthcare, just working at a nursing home in a long-term care unit. It's long-term. They're there kind of most of the time for the end of their life. So I had always kind of been used to that. Whereas at the hospital, I was able to see people come in, get treated, get better, and most of the time go home. So that was something that was really nice to see. As a nurse, there's going to be so many different careers. So you're going to be able to kind of choose what you like to see as you take on that job. Final thoughts. My internship at the Cheyenne County Hospital and Clinic through the Nex-Gen program was very beneficial, really good experience going into nursing school that maybe not a lot of people are going to have. I would recommend this to anybody who wants to have valuable experience going into something in their future career that they want to do. So I would just like to say thank you to Nex-Generation and to the Cheyenne County Hospital and Clinic for this opportunity.